Right. So I think I'll get started with our introductions. So hello everyone, and thank you for joining us this afternoon or whatever time it is, wherever you are. We are really excited to be presenting this webinar today with our two guest speakers from the University of Texas Health Science Center on a new clinical app to guide clinicians on the management of genetic aortic disorders and to empower patients to take informed decisions in their medical care for their disorder. I go to the next slide. So I'm Chrisanne Campos with the Genetic Aortic Disorders Association Canada, and with me, co-hosting with me is Ellen Hostetler, the Chief Science Officer from the John Ritter Foundation. I know many of you have already heard about our organizations, but I'd just like to take a brief moment to talk about GADA being a patient advocacy organization supporting genetic aortic disorders for patients as well as medical professionals through our programs of promoting research, awareness, and education. And one of the biggest research programs that I'd like to talk about today, just because it's applicable to today's talk, is the Montalcino Aortic Consortium. GADA funds the registry of the MAC, or the Montalcino Aortic Consortium, that is housed in Houston, and it's an international collaboration of aortic disease experts collaborating to drive precision medicine for genetic aortic disorders. So individuals who have an aortic dissection or a family history of aortic dissection and a genetic diagnosis underlying that aortic dissection are eligible to be enrolled in this registry for research. Anyone with aortic dissection, it's very crucial to have genetic testing and a diagnosis, if at all there is an underlying genetic cause for aortic dissection, to inform the treatment and management for your disorder. And so we are really proud of supporting this registry, because so far the research that has come out from this genetic registry has been applied in the new guidelines for management of heritable aortic disease, and in the Genomic Medicine app that is going to be talked about in today's webinar. So if anyone has any questions about MAC or about this app, please feel free to write into GADA with your questions or any more information that you need. Ellen.
Yeah, thanks, Chrisanne. So I see a lot of familiar names here, so I'm sure some of you are well familiar with the John Ritter Foundation, but just briefly, we were established in 2003 after the actor John Ritter died from an aortic dissection. And our foundation is really dedicated to anyone who has suffered an aortic dissection, lost someone to an aortic dissection, or is at risk, and their families. So we have a big tent, but this does include patients with both known and unknown genetic aortic disease, as well as people who do not have a family history of aortic disease. We support in-person patient activities, as well as research. So if you are joining us today and you do not have a known genetic diagnosis for your aortic disease or your family members, I do encourage you to consider looking into participating in the John Ritter Research Program, which is at UTHealth, where both of our speakers are from today. This is a program we're proud to have funded for, I think, almost 15 years now, and they are looking for all of the genetic causes of thoracic aortic disease. So I do encourage you to look at that. You can contact me if you'd like to get in touch with their study team as well, and I can put you in touch. And then if we just want to go quickly over the disclaimer. Today's webinar is not intended to be a substitute for medical advice or information, but rather this is a educational and learning format. So please take a moment to read over this full disclaimer here, or you can find it on our website. But please do follow the information from your individual aortic clinicians that care for you, and view today's webinar as an educational forum only. And then just housekeeping, feel free to introduce yourself in the chat. I think if we can make sure that's open to participants to talk in, or put your questions in the Q&A. And after the presentations, we will answer as many of them as we can. This is being recorded, as you know, and we will make that available to all on the GADA as well as JRF YouTube channels following this event. So you can share it with your clinicians, physicians, family members, or review it yourself.
Great. So we're really excited to have with us Dr. Siddharth Prakash. He's a cardiologist at the University of Texas Health Center. His clinical interest focus on bicuspid aortic valve, thoracic aortic aneurysm, and adult congenital heart disease. Dr. Prakash has collaborated with both of our organizations, GADA and the JRF, to promote exercise for people with aortic disease. And his practice philosophy includes continuous assessment, participation in research, and guideline-based therapies. Also with us is Dr. David Murdock. He's a medical geneticist at the University of Texas Health Center. And his research uses advanced molecular and computational techniques to study the genetic factors that drive aortic disease. He is leading the integration of artificial intelligence for both screening and treatment of thoracic aortic disease, including the facial recognition pattern for early diagnosis of these patients. And so that's going to be part of his talk, is the integration of artificial intelligence and facial recognition in the Genomic Medicine Guidance app. And also with us is Dr. Prakash's student, Rohan, who will also talk to us a little bit about the app in today's talk. So I'd like to hand over this to Dr. Prakash and take over the webinar from here.
Thank you. Thank you, Kristen and Ellen. It's my pleasure to be here today and to talk to you about something that we've been working on for several years and definitely need the help of everyone in the community to make this a possible tool. So I'm talking about our Genomic Medicine Guidance app. It's a point-of-care tool, meaning that it's meant to be used in the clinic for people who have a diagnosis of heritable thoracic aortic disease. I'll talk a little bit about how we developed the app, what it's like to walk through the features of the app, and what it can do for patients and doctors. I have nothing to disclose. So some people might wonder, why do we need an app about heritable thoracic aortic disease? And the reason is that there is a gap in education and communication about the genetics of aortic disease. Up to 50,000 people are diagnosed with a form of heritable thoracic aortic disease every year. But genetics is frequently not used because there are few trained people who are familiar with genetics. And at the same time, more and more people are getting genetic tests and coming to their doctors with a diagnosis related to a gene mutation in their families. And this app was really developed to help bridge those gaps and to help people understand how to use genetic information to plan and manage the treatment of these disorders. And a lot of this is based, as Chrisanne mentioned and Ellen mentioned, on the 2022 guidelines that many of you may know. So our app is really designed to reduce the barriers to understanding and using genetic information to your help, for your health. You can look up your specific gene and variant in the app and receive advice from the clinical treatment guidelines that match your condition. And right now we have data encoded for 13 genes and 2,270 unique variants, which are shown on the right here. If you notice, most of these genes are the most frequently found to be mutated in people with a family history of aortic aneurysms or dissections. There are others, and in the future, we may expand the focus of the app, but I will walk you through a little bit of the features first. So the idea about this app is that someone may have a genetic test result and may not fully understand what that means for their health. With this app, you can select a gene and a pathogenic or a likely pathogenic variant that is from the genetic test report, indicate how it's related to your health conditions, and then you can get either results for clinicians or results for patients. And that is based on the wording and the way the results are formatted. You can then print these out and take it to your doctor or use it to ask questions that might help you at a visit. The idea is we're trying to bridge between the genetic information, which can often feel overwhelming and very distant and technical, and the kind of treatment that you need to advocate for yourself and your family. And how can we do this in a way that is as efficient as possible? That was the reason we decided to embark on this. So this is an example of the home screen for the app. You can see that there is a drop-down list where you can select one of the genes that I showed you on the previous slide. You can select one of a specific variant from the drop-down list, and we collected these from the MAC data that Ellen mentioned, and also from other sources where publicly available data, where these genetic variants are contained. You can then enter some information about who was tested and why, and that helps us understand why this particular variant might have been selected. And then you can, going down, you can either choose clinician results or patient results. If you notice on the front page, we have information resources, including the Aorta Academy from the John Ritter Foundation and Marfan Foundation. So many of these also walk you through the reasons for genetic testing, what kinds of questions you might have, and provide a framework for this kind of approach. We also have ways to participate in research if you're interested in the output page. Let's go through a typical patient result page. You might see, you'll see a menu that comes up about different aspects of your diagnostic journey. So what happens if you're newly diagnosed? How often do you need to follow up with your providers? What kind of tests do you need? What kind of medications might you need? And what are some things that you might need to watch out for to prevent problems down the road? So if you click on any of those, you would go to the sections, but I'll just show you what the top of it looks like. So it tells you what variant you chose and what some common things that can happen associated with that variant, in this case, an ACTA2 variant. And then below that, it will tell you about the average age in which people develop problems for the first time if they have a variant like the one you selected. And this is based on information from our research. It also gives you information on how to ask your family members or who in your family might need to be screened, either by a genetic test or by another kind of testing. And so this kind of information doesn't mean that everybody who has this variant is going to get these problems, but it might help you to understand why your doctor might order certain tests, or it might help you to ask questions about your health based on information from the guidelines, as I mentioned. So this, you also get information about what tests you need and how often you need them. So how frequently should you be expected to get specific pictures of your aorta or other blood vessels? How often do you need to see specialists? And if there are any special things about that are known to affect people with that genetic variant, they will also be listed under recommendations based on the selected variant. And then at the end, you can email the results to yourself. You can download them and print them. And you are also invited to take a survey. And the feedback survey is very important to us. We want as many people who use the app to give us feedback, because we know that a lot of things related to the language need work, and we're continuously trying to improve. And then you can see at the bottom, we have a research opportunity on how to connect to the Montalcino Aortic Consortium. If you are interested in joining us, we are consistently trying to improve our ability to give this kind of information. And that's how we got most of the data that's in the app to provide to you. So some people ask, well, what if my variant is not on the drop-down list? You can actually enter your own variant, and the app gives you a guidance on how to do this. You can see sample genetic test reports with highlighted areas about what you need to enter into the app. And if you click this button, it will guide you, it will walk you through how to do this in several different steps. You can enter your information, and if at that point, you can enter any clinical information you want about the person who has the variant. And in a feature that we are building, if someone else enters the same or similar variant, you can opt in to be contacted or notified. And the idea here is that we want to get or learn as much as we can about new types of genetic changes that might affect people with heritable thoracic aortic diseases of all types. And we're consistently trying to learn more about that. You can also select clinician results on the same menu. And if you do that, you will get more technical language. And this includes information about the specific tests that doctors might need to order, the kinds of diagnoses that they might need to enter into the medical record. And it gives more specific information about the expectations for the patient, how quickly or frequently they need to be checked because of the concern for the rapidity of the change in their aorta. So in this case, we're highlighting the arginine 179 ACTA2 mutation, which has a more severe clinical course and would affect younger people, and would be important to know about if you're planning to follow patients as a doctor and decide on testing frequency. So the goal here is that there are 4 groups that were really intended to use this app. Obviously, patients and providers are the most important, but it can also be used for research to learn about new forms of heritable thoracic aortic disease, new variants. It can be used by genetic professionals who might use this to understand how certain variants might be related to disease. And of course, it's very important for education, both for patients to learn more and feel more empowered about their genetic diagnosis. But I would argue patients can also educate their providers, because not all providers, especially in certain areas, may be familiar with these conditions, they're rare conditions. And this could provide an entry point for the patients to really advocate for themselves. In addition, we know that patients may want to connect with other patients who have similar genetic variants, because they're very rare and it might be difficult to do so otherwise. So in the long run, this could foster a community approach to thoracic aortic diseases that we think could have long-term benefits, both for research and patient care. So if you're a patient and you're wondering, how can GMG help me? These are some things to think about. You could print out the information about your gene and variant and bring it with you to your appointment. You could use that information to think about questions that you could ask your doctors at the visit. You could access resources from our homepage about your genetic diagnosis, genetic testing, or how to find a genetic counselor near you if that's something that you need. In the future, we're hoping that you will be able to connect with another family who has the same or similar variant as you do. And as we're going to hear, we plan to try to integrate AI facial recognition technology, in which case it could guide people to the diagnosis and gene using facial recognition as the entry point instead of a genetic variant. And this could potentially help in urgent or emergent situations where you may not know the diagnosis ahead of time. So with that, I'd like to acknowledge the long process that it's taken to get to this point. This started as a grant from the NIH and with support from our Clinical and Translational Sciences Division at UTHealth Houston, and the Inter-Society Coordinating Committee for Practitioner Education in Genomics. So there have been many different groups involved, and As I mentioned, we are still improving the app. We definitely want your feedback. This is the accessible form of the app that's currently online. You can either scan the QR code or go to this address, and it's freely available. We do urge everyone who tries it to fill out the survey and give us more feedback information as we go forward to improve the app. Thank you. Rohan, did you want to say anything about the app that I didn't get to?
Yeah, so just to introduce myself again, I'm Rohan. I'm a student with Dr. Prakash here at McGovern. Really, what's really important to us is just getting feedback. It makes it really important because we can understand what is best, specifically for patients too. We obviously have worked a lot on this patient-facing side. However, it is clear that sometimes the language may not be the best for patients. Sometimes it may be too technical. Sometimes it may not be enough. So we really encourage everyone to fill out the feedback at the end. It'll make it much more easier for us to understand what we actually need to do and the next steps we need to take to make it easier for patients to understand the content that we have currently. So yeah, just highly encourage anyone to do that if you can, and that'd be great.
All right. Thanks. Are we going to pause here for questions, or should we continue with the next presentation? I can stop.
Yes, I think we'll continue with the next presentation, and then at the end of it, I'll address questions.
Okay.
Thank you. Thank you for that, Dr. Prakash.
All right, so maybe I'll take over.
Yes.
Okay. Okay, so is it full screen or is it the presenter mode?
It's the full screen. It's good. It's good.
Perfect. Okay. All right, so yes, I'm going to be talking about some of the work that I've been doing to incorporate AI into diagnosis, so specifically recognizing characteristic facial features for early diagnosis of HTAD conditions. And so I just, again, want to thank GADA specifically for their support of the Multigenome Aortic Consortium, MAC, because all of this work is through MAC, which is supported by GADA, so thank you. So I wanted to start off with a couple of images, just to kind of give you some understanding of what we're hoping to do with this approach. These are not actual patients. These are AI-generated composite images, so kind of classical, the classical faces that we see for Marfan syndrome, they're on the left, and for vascular Ehlers-Danlos syndrome, or VEDS, on the right. And so, you know, as a clinician, as a geneticist, I see the characteristic facial features of these conditions in both of these pictures. So on the left, I see for a Marfan patient, kind of the classical long face, the small recessed jaw, the eyes that have kind of a characteristic shape, as well as the positioning of those eyes. On the right is someone with vascular Ehlers-Danlos with the prominent eyes, with kind of the thin lips and the pointed nose. And so these are some of the kind of typical facial features that we're looking for whenever we see a patient in clinic. And it helps us to guide genetic testing, as well as give us an idea of what the underlying diagnosis might be. But it can be, you know, quite subjective. These facial features can be quite subtle. Not everyone has a classic face of one of these HTAD conditions. And, you know, for the general population, or the, you know, general medical providers, they're not necessarily familiar with a lot of these facial features that can kind of clue you in that there might be an underlying genetic condition. So that's something that we're trying to change. You know, we're hoping to develop a tool that can take just a simple picture of an individual, and then give you an idea of the likelihood that they might have an underlying genetic predisposition to aortic disease. So what are the kind of, you know, basics to this approach? So let's say we have an individual that comes into clinic that when I look at them, I do see kind of typical Marfan-like features, but let's say this person doesn't have a known diagnosis. So the goal of a tool like this, an AI tool, is to actually extract those characteristic facial features. So we can have the AI tool actually look at the image, look at the picture, and extract those facial features that are kind of shown here with those blue dots, and then take those and form what's called a facial encoding. And then that encoding goes into what's termed a deep neural network. And that's really the AI part of this. So, so kind of the AI brain, the computer brain that's been trained on hundreds, if not thousands of images from the general population, as well as from individuals with these various HTAD conditions. So that AI brain has been trained to recognize the patterns. So then it can compare that to that facial encoding of this individual, and then give us kind of a likelihood of what the underlying diagnosis might be. In this case, most aligns with Marfan syndrome. So that's kind of the basic idea of this type of approach. And so the goals of this overall project are to define the facial phenotype, something we call the facial gestalts, for all these different types of HTAD conditions. So Marfan syndrome, vascular Ehlers-Danlos syndrome, all the different types of Loeys-Dietz syndrome, and other related HTAD conditions. And then, as we heard about before, to implement this in kind of an open, accessible platform. So ideally a mobile phone app that anyone can use. So not just geneticists in the clinic, but anyone, a pediatrician seeing a child in clinic, or a school nurse, or even an emergency physician seeing a patient in an emergent situation. And really the goal of that is to make an early diagnosis so that guideline-based management can be implemented. Because as was alluded, there are now the 2022 ACC AHA guidelines for aortic disease management that include gene-specific guidelines. But to benefit from those, one has to know that they have an underlying genetic risk. So we want to change kind of the paradigm where someone is only suspected of having one of these conditions until after a dissection or even after death, to being diagnosed much earlier on. Because that's, unfortunately, we frequently hear that where it's only after an event that the diagnosis is suspected. For vascular Ehlers-Danlos, for example, despite the improvements in management and what we know about the genetics of VEDS, about 70% of affected individuals are ascertained after a vascular event or after death. So that means that the majority of patients are not benefiting from a lifelong guideline-based management. So that's something we want to change. So this idea of using facial images for diagnostic purposes is not a new one. There's a company that we're actually working with, Face2Gene, another group that we're collaborating closely with at the University of Bonn in Germany. They've developed something called Gestalt Matcher, which are great tools, but they're more for general genetics. So they're not HTAD specific. And so we're also looking to develop something that is HTAD specific, but also gene and variant specific. And so what does that mean? So for example, many of the existing tools are not able to differentiate between the types of Loeys-Dietz syndrome. So Loeys-Dietz is there are 5 or 6 different genes that cause it. And each of them is really an independent syndrome with different features and even differences in management. And so we wanted to develop a tool that can really differentiate those different subtypes and not just lump everything into Loeys-Dietz syndrome. Furthermore, there are newer AI models and image data sets that have been developed by companies like Google, Facebook, Microsoft, that are really accurate. And fortunately, many of those tools are freely available for anyone to use. So we have used those and implemented them for this very specific use case. You all may have noticed that when you take a picture on your phone, frequently it gets tagged with the person who's in that picture, or even animals in some cases. So the technology is there. It's just we need to implement this for this very specific use case. So we can take those kind of facial encodings that are from these individuals with different HTAD conditions, and we can plot them together in something that we call the clinical face phenotype space to get an idea of some of the similarities and differences between those different conditions. And so that's what's done here. So each of those points is a different individual with a different type of HTAD condition. So in red are the VEDS patients, the blue are the Marfan patients, and the yellow are the Loeys-Dietz type 2 patients. And so what you can hopefully appreciate here is that there is some clustering. So, and what this shows you is that the closer that the points are to each other, it indicates more similar facial features. And so, especially with vascular EDS, those individuals tend to cluster very closely together, and it's very distinct from Marfan and Loeys-Dietz type 2. You do see some clustering within those conditions as well, but then there's some overlap between Marfan and Loeys-Dietz. And that's something that we see definitely in clinic as well, that sometimes we have trouble differentiating between Marfan and Loeys-Dietz patients without genetic testing. So this kind of more analytical approach confirms what we've been seeing kind of clinically, and it also shows that VEDS patients that facial phenotype is quite distinct from the others. So that's great to be able to compare these different conditions amongst themselves. But what about using this as a screening tool to determine whether someone might be at risk for one of these conditions? Well, for that, we would have to have some kind of control images, so some images from the general population. And for that, we use something called the Chicago Face Database, which is it's a large data set containing many pictures across different age groups, ethnicities, and sexes. And we've used this as kind of our baseline to compare our images from our HTAD patients within the MAC registry. And so when we do that, we find that there are indeed distinctions between VED, Marfan, and Loeys-Dietz type 2 and the general population, this control population. And so we can do kind of a statistical analysis and plot that analysis in different ways. And so what I want you to take away from here is that in each of these plots, that orange distribution, if that falls to the right of that kind of dotted threshold line, that implies that the facial phenotype for that condition is different and distinct from the control population. So for VEDS, Marfan, and Loeys-Dietz type 2, all of those fall to the right of that line. So that shows that yes, in fact, the facial phenotype is distinct from control. And why do I show you mainly VEDS, Marfan, and Loeys-Dietz type 2? Well, those are the three conditions that we have the most pictures from. So because more pictures is better. So this just goes to show that the facial phenotypes have similarities and differences between themselves, but that they are all distinct from the general population. And if we include those control images on a plot similar to the one I showed you before, those are the general population images are in orange. Those tend to all cluster together. And if we draw kind of an orange circle around them, we see that the vast majority of individuals with these HTAD conditions fall outside of that area. So that shows that that this kind of approach can be used for screening purposes to identify, for example, here, an individual that has Marfan features and is more likely to have Marfan compared to someone who has no features and has very low likelihood of having one of these HTAD conditions. So I mentioned before about variant-specific analysis, and so I'll talk a little bit about COL3A1, the gene that causes vascular EDS. So we know that different mutation types within COL3A1 impact the vascular severity of this condition, something called the genotype-phenotype correlation. So individuals with glycine substitutions tend to have earlier onset of vascular disease, whereas those with loss of function variants that lead to something called haploinsufficiency tend to have later onset. And kind of anecdotally, we've also noticed that those with loss of function haploinsufficiency variants tend to have milder facial features than those with the glycine substitutions that have the more classical VEDS face. But when we do this kind of analysis using AI, we see that when we group those patients together, the AI tool is able to recognize those equally well. So the facial phenotype or facial gestalt for all mutation types in COL3A1 is similar enough that we can group them together. So that was really important because we wanted to demonstrate that this kind of technique can be applicable to not just some mutation types, but all mutation types, and that's what we showed here. So so then you have to ask the question of, well, how many pictures do we need? And for this, we've mainly used images from VEDS patients because we've actually had quite a bit of support from the VEDS community. And so we have quite a lot of facial images from those patients. And so what we found was that if we train the model on more and more images, as you would expect, the performance gets better. But somewhere around probably 10 or 11 is the minimum that we need to get pretty strong results, something that is kind of clinically applicable or acceptable. So here on the bottom, the x-axis are the number of facial images used for training the model, and there on the y-axis is the kind of the accuracy. So what you really want is for it to be at the top around the 1 value. That indicates basically 100% sensitivity. So around 10 or 11 pictures, it gets to about 80%. But then as you add more images, it gets over 95% accurate. So this kind of established that 11 pictures is probably the minimum that we need. So that's kind of what we're targeting. And since we want to make this as applicable to people of all ethnicities, age groups, and sexes, we're targeting having at least 11 genes or more for all of these different categories, subcategories. So so then I'll just finish by talking a little bit about something to kind of better understanding what the AI model is actually seeing, because one of the issues with AI is that it's a bit of a black box. So we don't really know what the AI is seeing, what pattern it's recognizing. But there have been some tools developed that are kind of called explainable AI that allow us to kind of open that box and look into actually what's driving that model. And so that's what we've done here using a framework called PhenoScore. And here, this image, this is comparing VEDS versus control images. And the areas that are highlighted in blue are the ones that the AI model has really focused in on and recognizes those as being distinct from controls or from the general population. And so what we see here is that just by using 11 or more images, the model has really focused in on exactly what we see as clinicians. So the prominent eyes, the pointed nose, the thin lips. And so it's very accurate, and it just goes to show that the VEDS face is quite distinct from the average face. Well, what about comparing it to hypermobile EDS, which is another condition that falls under the umbrella of Ehlers-Danlos syndrome, but it's much more common. It's associated with hypermobility, but not the vascular complications that are present in vascular Ehlers-Danlos. There's also not a known gene that causes hypermobile EDS, unlike VEDS, which is due to COL3A1 mutations. So when we compare VEDS and HEDS, we see essentially the same thing that we saw when we compared VEDS to the general population. We saw that this AI model is able to recognize differences in the eyes, the nose, and the lips, and those are really distinguishing factors from HEDS patients. So this kind of clearly shows that the VEDS face is distinct from the hypermobile EDS space. And so that's really important because another issue is that VEDs and HEDs are frequently kind of confused with each other, and that the management is quite different. So knowing that someone has a VEDS diagnosis is very important in making sure that they get the right management, especially in kind of an emergent situation. And when we compare HEDs to the controls or general population, we see that essentially the AI model is not really able to distinguish the difference, which suggests that the HEDS face, typical face, is very similar to the overall average face in the general population. So, so really, the goal of this again is to have an app that you can, let's say a pediatrician seeing a child in clinic can use this on to identify them early on, so that they can be diagnosed and start medication, start imaging, so that they can, have a lifelong amount of appropriate management and have, as best a life as possible. Or, let's say a teenager undergoing a sports physical, the school nurse can use this, and let's say it tells them, oh, you have features that are consistent with Marfan syndrome. So they get an echo and are found to have a dilated aortic root and are managed appropriately. Or even in the emergent situation where, let's say a young person, a 30-year-old comes in with chest pain, low blood pressure, and they're really not clear what's going on, something like this could be used to say, oh, well, you have features of Loeys-Dietz syndrome. And so that would prompt them to maybe get a CT scan or very different kind of management than would otherwise be done. So all three of these settings is possible, as well as many more. But we're hoping that as Dr. Prakash was saying, that a tool like this could be used as an entry point, rather than kind of what the current standard is, where someone maybe recognizes some features or has a dissection and then is sent for genetic testing much later on. We really want to get them diagnosed early so that they can benefit from lifelong management. So with that, I'll end and just thank my Dr. Milowitz and others who I work closely with, and I think that wraps us up. So are there any questions for us?
Hey, thank you so much. Thanks, Dr. Prakash and Dr. Murdock and Rohan, for explaining the app and the AI integration into the app. It's also interesting and also useful for patients as well as for clinicians in the diagnosis. But I understand the GMG, the Genomic Guidance app. It's very genetic, so you need to have a genetic test done. You need to know your genetic diagnosis to be able to use the app. And so far, without the AI component in it or the facial recognition component, how can patients, if they don't know their variant, but they have a history or an aortic dissection, would this app be useful to them at all?
I mean, I can answer that. So obviously our app is predicated on knowing your genetic diagnosis, but we can imagine a situation where someone might need guidance on, for example, what characteristics might prompt the need for genetic testing, and facial recognition could be part of that. So as an entry point into knowing into determining whether the genetic the gene mediated diagnosis and workup is required, these sorts of additional components on the front end of the app could be very valuable, because as you said, it would expand the number of patients who would potentially be eligible for this kind of approach.
And physicians that come across a variant that's not in the app, how can they participate, or how can they put in a new variant into this app or in the research for this app?
Yeah, so putting in a new variant is actually very easy. You can click that it's not on the list. It will, the app gives you the opportunity to enter the new variant in a stepwise approach with examples from genetic test reports of each piece of information that you need. And then based on that, you can also access the data for the mutated gene, kind of the average information that you would get from what we know about individuals, all individuals, like all comers that have a variant in that gene, but not necessarily variant-specific information, which would not be appropriate for a new variant or a variant that wasn't already cataloged in the app.
Yeah, yeah.
We have a question from someone, and I get this a lot actually, who says they have Loeys syndrome, and actually looking at their registrations, we saw it a lot as well, that people put in Loeys syndrome and they didn't put in necessarily a gene or even variant. So what would be your general advice to someone who all they know is that all they were told or all they remember is that they have Loeys syndrome? Can you talk a little bit about why it's important to know what type or what gene is causing that?
Yeah, that's great. So the entire project is really predicated on knowing the gene and variant. And the reason for that is based on the 2022 guidelines that we were talking about and data from the Montalcino Aortic Consortium, where we showed that not only knowing the gene, but also the variant predicts things like how quickly aortic dissections could happen, whether they happen more frequently in males or females with that variant, whether there are other features that you might need to look for or ask your doctor about, besides just aortic disease, for instance, other heart problems. And so it really does affect the screening test that you need, the kind of management that you need. And in the future, we expect that actually medications might change based on the kind of gene variant that you have. So it will become increasingly important for people to know their gene and variant. And if you don't know that, we would definitely encourage you to ask that question at your next visit.
Yeah, so there's been really great appreciation for this app. Both the tools are really great. There's a question here for, what are the current and future plans to push these tools out for healthcare providers to use? If you could comment on that.
I mean, from our approach has been to work with our advocacy organizations like you both, GADA, Marfan Foundation, John Ritter Foundation, because we think that the best opportunity for our community to receive these tools is through a trusted provider like you. And if we find a home for the app in any of these in any of the websites from the organizations, if we can make that a part of the clinical conversation or the discussion in our communities, that will be successful to us. And in terms of broader outreach, we've reached out to to groups like general cardiologists, but that is extremely hard to do because, as David mentioned, it is a rare disease and most people don't have this on their radar. So I think, our focus has been on you all and the aortic disease community first. David, do you have any comments on that?
Yes, I mean, yes, I think, getting this into the hands of as many healthcare providers, I think is really critical. I mentioned the pediatrician, the school nurse, the ER physician. So, not even necessarily a cardiologist or surgeon necessarily, because we want to implement this in a way that it's easy to use for anyone. And because we know that preventative care, early management is really critical to optimizing outcomes for this group of individuals. And so really, in whatever way we can do that, is what we're looking to do. So yes, I mean, I would say also that it's really important for us to get as many images as we can to train the model even better for a lot of these different conditions, all the different subtypes of Loeys Dietz, for example. So just a call for anybody watching who has one of these conditions. If they're interested, they can always contact us. But yes, I mean, I think we're really looking to get this into as wide an audience as possible, so that really anyone, any provider of care is able to use something like this.
Dr. Murdock, there's a comment in the chat from someone who was diagnosed with an ACTA2 mutation and is interested in participating,
Yeah.
which brought up the question for me that you showed in your slides, VEDS and Loeys Dietz and Marfan syndrome. Has this been tested for non-syndromic heritable thoracic aortic disease genes like ACTA2?
Yes, excellent question. So good point. Maybe I'll just say, there's syndromic conditions like you mentioned, Marfan, VEDS, Loeys Dietz, and then there are non-syndromic conditions like ACTA2, MYH11, and others. And so those traditionally have not been thought to have kind of a typical facial features, which can make them quite difficult to diagnose because of that. And so that is definitely something that we are focused on doing. One of the issues has been that we just don't have enough pictures. There are a lot of publications on Marfan, on VEDS, on Loeys Dietz. A lot of people are in our MAC registry. So for those conditions, those syndromic conditions, but we have fewer for ACTA2, and ACTA2 is actually the best one of the non-syndromic conditions, but then kind of trails off after that. So I suspect that it may not be as accurate as for the syndromic conditions, but I wouldn't be surprised if with enough images we are able to, the AI tool is able to spot some features. Whether it's in ACTA2, maybe it's in the the pupils, the dilated pupils, so we have seen it even with the limited number of images for ACTA2, some suggestion of a signal but it's not quite statistically significant yet. But I think that if we got more images, we would be better able to answer that question. So, but I hope so. I certainly hope that this kind of tool would be applicable not only to syndromic conditions, but also to the non-syndromic ones as well.
Okay, well, the person who commented, please, it sounds like they have a strong family history of it too, so perhaps they can get in touch and be willing to offer a whole bunch of their family images. This is a question I just have myself. I wonder, in the future, do you think you would be able to use this for VUS resolution? If you had a VUS in Col301 and you put this in the app and it said, no, we don't think it's this, would you personally, give it more weight, or do you think it could be used in that way in the future?
Yeah,
go ahead, sorry.
Or at least when we were envisioning this, we thought it could be very useful for VUS resolution because these variants are extremely rare. It's very hard for people to connect. And if you have information from more than one family, which is often critical to determine whether this variant actually causes disease, it may be the best way to connect all of the resources together from different areas, maybe using different testing platforms and not otherwise talk to each other, right? So it might allow the community to come together to learn faster, which is one of the things that we would advocate in the Montalcino Aortic Consortium. That was the purpose of the registry, is to really do this. And this could help that goal.
And I think also the facial analysis could potentially be helpful in VUS resolution, and that's something that we're working on as well. Maybe use it to kind of decide one way or the other if a VUS is more suspicious than not. So yes.
Right. There is a little bit of a specific question here on a particular gene from LOX. We've spoken about LDS and FBN1 and, morphin and LDS and ACTA2. But if someone has a LOX mutation and the aortic dilation is holding steady at 47 millimeters, but has a vertebral dissection, they're just asking for what are the reliable tests to detect arterial aneurysms not dissections, but aneurysms.
Yeah, so as with most things, advice for these kinds of individual situations can be very personal, and it is difficult to provide accurate advice without knowing the whole story. So I don't want to do anyone a disservice and comment without understanding their personal situation. And that's why I would urge them to discuss this with their aortic provider, because those are incredibly important questions. And that's one of the things that we hope to prompt people to do with the app, of course, is to give them a list of things. These are things you might want to consider when you go to the doctor next time.
Yeah, and that's this.
And if nothing else.
Yes. Yes, that's fantastic. Ellen, did you have any more questions? Because we're almost approaching the hour.
Yeah, I was just looking through what people wrote in for their registrations to see if we missed anything, but I think we've covered a lot of
it. I think there was a question that on FBN2 again, but it's gene specific and patient specific, individual specific. This patient also has autism, and so they were just wondering how they could control the blood pressure in this patient. But I think this app is very useful, like you said, to take information from it and discuss it with their physician.
One thing that someone wrote in the comments and then also in registration was just a general kind of question about if you did not receive a genetic diagnosis after testing, how frequently should you go back and look more? There was someone who wrote in that both they and their sister both have had dissections, but unfortunately did not come up with any results on testing where clearly this is a case where there must be something heritable going on. So what would you, I guess, recommend to people who might be in that position?
David, do you want to take this?
Yeah, sure. So generally we recommend if, it sounds like, a history like that, if clinical, panel testing, I'm assuming, was sent and it was negative, we generally say maybe every 3 to 5 years, maybe consider repeating testing. It really depends on kind of how many genes were tested before, how was it done, et cetera. But so that's kind of, generally what we say. For this case, if it sounds like, there's a strong familial component, we might also, suggest that they maybe reach out, to a group like ours to get involved in our research studies, where we do more comprehensive kind of research type testing, whole genome sequencing, for example, to try to find these kinds of genetic causes, whether they're novel genes or maybe in non-coding regions that aren't typically sequenced. So yes, I mean, that's kind of generally what I would say in this condition, but it sounds like in that case, they might be a good candidate for research testing, and so could reach out to us.
Great, thank you. I think that covers it on my end.
Yeah, yes, and I think if we come across more questions, and I think it's more on getting more patients to participate in this research, to use this app and give their feedback, which you've mentioned in your talks. The feedback is really crucial for this app to be more successful and more widely used. So please, I ask everyone who's here at the talk and who will listen to the talk later to try out the app if you know a genetic diagnosis and provide feedback for it. And I thank you so much, Dr. Prakash, Dr. Murdock, and Rohan, for being here to share this information with us. It's been very educational, and this session has been recorded, so it'll be available on the GADA and GRF YouTube channels. Yes, and you can connect with us through the GADA website or through social media. We will send out a notice for this webinar as soon as we have the recording ready. Thank you again. Thank you very much for being here today.
Thank you.
Thank you.
Thank you, Ellen.